Hi everyone, my name is Sepideh Mehravar. I'm internal medicine resident and a researcher at MAST Program at Cedars-Sinai, and today I'm presenting our work titled Adoption of New ICD Code for Intestinal Microbial Overgrowth Syndromes. In October 2023, the World Health Organization introduced new ICD code for small intestinal bacterial overgrowth, or SIBO, and intestinal methanogen overgrowth, or IMO. But not a lot of providers are still adopting this ICD code. So the purpose of our study was to figure it out how many providers are taking and adopting these ICD codes and what is the treatment and demographic trends among them. For the purpose of our study, we use TriNetX database, which includes the identified medical records of over 100 million patients all over the US. For this purpose, we identified adults with ICD code of SIBO and IMO from November 2023 to May 2025, and we analyzed their demographics, ethnicity, race, and treatment patterns among them. Let's take a look at our result. In our study, we found out that over 1,800 patients with IMO and over 16,000 patients with SIBO were identified in this database. And they were mostly female, and their average age was around 50-year-old. And when we take a look at treatment patterns, in patients with SIBO, rifaximin was the most common medication prescribed, and in patients with IMO, neomycin plus rifaximin was the most common medication. In conclusion, adopting this new ICD code will help us to have a better diagnostic and treatment patterns for these patients. But the differentiation is lacking. We need to be able to differentiate SIBO from IMO to be able to have more accurate and tailored care for these patients' population. Thank you so much for listening, and please checking out our poster at ACG 2025.